Ever wondered if a medication prescribed for one thing could be used for something completely different? It sounds a bit strange, but it happens all the time in medicine, and it's called off-label prescribing. Today, we're diving into a fascinating area where this is common: seizure medications. So, what exactly does off-label mean? When a drug is approved by a regulatory body like the FDA, it's for a specific condition, dose, and patient group. That's its label. But doctors, using their clinical judgment and experience, can legally prescribe that same drug for other conditions if they believe it will help their patient. This is a standard and often essential part of medical practice. Now, let's talk about seizure medications, also known as anticonvulsants or antiepileptic drugs. As the name suggests, their primary job is to prevent or stop seizures by calming down overactive electrical signals in the brain. They are the cornerstone of treatment for people with epilepsy. But here's where it gets interesting. Over the years, doctors and researchers noticed that the brain-calming effects of these medications could be beneficial for a whole range of other conditions that aren't related to seizures at all. One of the most common off-label uses for seizure medications is in managing certain types of pain, especially neuropathic pain. This is pain caused by nerve damage, and it can feel like burning, shooting, or tingling sensations. Conditions like diabetic neuropathy or post-herpetic neuralgia, which is the lingering pain after shingles, often don't respond well to typical painkillers. But drugs like Gabapentin and Pregabalin, originally developed for seizures, have become first-line treatments for this kind of nerve pain. They work by interfering with pain signals sent by damaged nerves, providing much-needed relief. Another huge area for off-label use is in psychiatry. The same mechanisms that stabilize electrical activity in the brain to prevent seizures can also help stabilize mood. That's why certain anticonvulsants, such as Lamotrigine, known as AvKare, Valproic acid, also known as Depakote, and Carbamazepine, brand name Tegretol, are widely used as mood stabilizers in treating bipolar disorder. They can help manage the intense mood swings, from the highs of mania to the lows of depression, offering a more balanced state for patients. For some people, these medications work even better than traditional psychiatric drugs, and it doesn't stop there. Some seizure medications are prescribed off-label to prevent migraine headaches. Topiramate, commonly called Topamax for example, is not only used for seizures but is also FDA approved for migraine prevention. Others might be used off-label for the same purpose. The idea is that by reducing the general excitability of brain cells, these drugs can help stop the cascade of events that leads to a debilitating migraine. They can also be used to treat anxiety disorders, fibromyalgia, and even restless leg syndrome. The versatility of these drugs is truly remarkable. But this brings up an important point. Is it safe? Off-label prescribing is a decision made by a qualified healthcare professional based on scientific evidence, clinical guidelines, and the individual patient's needs. It's not a random guess. Often there's a solid body of research supporting the off-label use, even if the drug manufacturer hasn't gone through the lengthy and expensive process of getting official FDA approval for that new indication. However, it's crucial to have an open conversation with your doctor. If you are prescribed a medication off-label, you should feel comfortable asking why. What's the evidence it will work for your condition? What are the potential benefits and risks? What are the possible side effects of any medication? Seizure drugs have side effects that can range from drowsiness and dizziness to more serious issues. So, being informed is key. In summary, the off-label use of seizure medications is a powerful tool in a doctor's toolkit. It allows them to treat complex conditions like nerve pain, bipolar disorder, and migraines effectively. It's a perfect example of how medical knowledge evolves, finding new ways to use existing treatments to improve people's lives. It's all about matching the right drug to the right patient, even if it's for a reason you might not expect. If you find this video helpful, please give it a thumbs up and subscribe for more content that demystifies the world of health and medicine. And as always, if you have questions about your own health, the best person to talk to is your doctor. Thanks for watching.